Hello, my name's Dr. Abigail Pamich, clinical psychologist. Now firstly, I'd like to say that depression is an illness and it's fairly common. About 1 in 10 people at any one time can get depression. So we call it the common cold of mental illness, but it is very painful when you suffer from it. So 4 things to consider. Firstly, when you have depression, there's changes in emotions. So you start experiencing intense emotional sadness or even intense emotional vacancy of just nothing there at all. But it's more than just feeling unhappy. It's much more deeper than that. It's a deep sense of darkness. It's like Churchill talked about the black dog following him around. There's like a black cloud that's there constantly, heavily weighing people down. There's a sense of helplessness, hopelessness. Things are not going to change. We talk about this, the depressive triad, the feeling hopeless and awful about the self, about the future and about the world. So the whole of the vision is clouded in this darkness and this hopelessness. People also have something called anhedonia, which is a losing interest in these things. So something that was previously enjoyed and gave a sense of fulfilment, that sense of fulfilment just disappears. They do the activity and there's just nothing there. There's an emptiness, a deep, deep emptiness and sadness. And that's what can lend people to feel suicidal, that life is just not worth living. So this is not the norm. It's not a normal sense of feeling sad about something or feeling down in reaction to something. It's a pervasive darkness, which is very, very different to our normal range of emotions. So there's changes in the body as well, quite strong physical changes. People can have trouble going to sleep, or they want to sleep for a very, very long time, or they're exhausted all the time. Many people report falling asleep and then waking up within an hour or so, and then repeatedly waking in the night and having just perpetual racing negative thoughts even though they're exhausted. So this kind of sleep disturbance is characteristic of depression. Have loss of appetite, extreme appetite changes, not wanting to eat at all or not being able to stop eating, reduced sex drive, aches and pains, loss of concentration. I've seen people who are avid readers that can't read more than a couple of pages. This is a brain illness. This is something that actually happens, that physically changes the chemicals in the brain. So it's not just normal sadness. There's changes in behaviour. So not wanting to see people, not wanting to go out, a struggle and inability to try new things, to learn new things, not being able to cope with stress, an actual change in behaviour in the way the person acts around people, much more withdrawn, much more quieter. And also there's different types of depression. So we have reactive depression, where we talk about this is people who react to something really awful that's happened, and often it's about their thinking patterns and their experiences and how they're interpreting and how that event affects them. We have melancholic depression, where it's much more consistent physical presentation, so there doesn't seem to be a trigger at all, and they just have this change in these brain chemicals and just feel absolutely awful for months on end. That's very similar with bipolar, where people just have these highs and then these lows. Or postnatal depression, that's quite a hormone-based depression, where people get, females get very, very down after the birth of a child, and they struggle to come out of that, and there can also be psychotic elements to that. So these are very physical things that affect depression. When I work with people, I look to see, is it reactive or is it melancholic? And we do really encourage medication, whether if it's a very much a physical depression, because there's so many changes within the body. So depression is very treatable, but it does need professional help, because it's much more than just sadness and feeling down. So if you'd like to have a conversation with me or one of my colleagues or book an appointment about depression, then please email me at inquiry@drabigail.co.uk or see my website, drabigail.co.uk. Thank you.